Hi everyone, Eileen Bayer of the Fam here. Welcome to the 5th or 6th installment of Bipolar Disorder mini-series, except for this one's not so mini because it's a lot involved with bipolar disorder. This one we're going to start the management part of it. It's going to be a 2 to 3 part series. I'm not sure yet. Because there's a lot involved in taking care of bipolar disorder. So today we're going to start covering the management, and that will probably continue. That will be continued on tomorrow, maybe the next day. I won't know until after tomorrow. So saying that, let's get started. Now, there's a number of, I have a hard time saying this word, so please bear with me. Pharmacological and psychotherapeutic techniques used to treat bipolar disorder. Individuals may use it to help, self-help towards their recovery. Hospitalization may be required, especially within the manic episodes presenting bipolar 1. Now, what they're saying is a person with bipolar disorder can do what's needed as self-help because they know where they are in their stages. So if they see or if they can sense an episode coming on, they can do what's needed for their recovery. Hospitalization can be voluntarily, which is your local legislating permitting, which some states will allow you to admit yourself into a psychiatric hospital for a certain amount of time to get help. Or it could be involuntary, which is called civil or involuntary commitment, which means the doctors can put you in, or your therapist, and they can put you in for a set time until they deem that you're fit to leave. Long-term inpatient stays are now less common, though, due to deinstitutionalization. Although these can still happen, they're just not as common. Following or in lieu of a hospital admission, there are support services available. Drop-in centers, visits from members of a community mental health team or an assistive community treatment team. They have supported employment and patient-led support groups, intensive and outpatient programs. These are just some of the things that are available to people with bipolar disorder. They are sometimes referred to as partial inpatient programs. The psychological part of it is the psychotherapy is aimed at alleviating core symptoms, recognizing episode triggers, reading negative expressed emotion in relationships, recognizing prodromal symptoms before full-blown recurrence, and practicing the factors that lead to maintenance of remission. So you see, just that alone, and we're not even going into the medications or anything, there is a lot involved with somebody with bipolar disorder. So really keep in mind when you meet somebody with bipolar, what all the things that they have to go through. Cognitive behavioral therapy is family-focused therapy and psychoeducation have the most evidence for effectiveness in regards to relapse prevention. While on the other hand, interpersonal and social rhythm therapy and cognitive behavioral therapy appear the most effective in regards to residual depressive symptoms. Now, most of these studies have been based only on bipolar 1. They haven't been based on bipolar disorder 2 or what I call bipolar disorder 3 because I have a hard time saying that word. It's been only on bipolar 1 disorder. However, all the treatment during the acute phase can be a particular challenge. Some clinicians emphasize the need to talk with individuals experiencing mania to develop a therapeutic reliance and support a recovery. So you can see how involved it is and just how much is involved in the treatment for bipolar disorder. And like I said, this is only part 1. Because it was so long, there will be a part 2, maybe a part 3. So remember, don't prejudge somebody. If you see something that's out of the ordinary, don't prejudge them. Try to understand where they're coming from. Understand what they're going through and how hard it is for them. Like I said in the last episode, a lot of people I know that have bipolar, their one wish in life is to be normal as possible. They don't like when they have episodes. We don't like it, but they have no control over it. If you followed the series from the very beginning, you'll see in there I have up a picture of a normal brain and a brain with somebody that has bipolar, and you can see a huge difference. So what they do, they have no control over. It's in the mind. So that's why you need to know. And I was asked a question on Twitter the other day. I'm not going to mention any names or anything, but I was asked a question on I had posted what people wanted for the next mini-series, and I had Hopkins disease, epilepsy, and a couple of other things. And the question that when I posted it that came up was, why do you call these disabilities mental illnesses? And this is the thing that people don't know. These are mental illnesses. Most of these things affect the brain, and that's why they're called mental illnesses. So it shows you just how much people do not know or understand about any of these disorders. And that's why, education is a must. And that's why I love doing these series, because I want to educate people. I want to help people. And by doing these series, if I can help one person be understood more, where they're not prejudged, help somebody that doesn't know about them say, I never knew that. Or somebody that's suffering with it, saying, help them to say, thank you for bringing it out in the open. Thank you for helping people realize what this is about. Because it's not fun for them. For any type of illness, whether you have a physical disability, a mental disability, they deserve the same love and understanding that anybody else does. And they're not going to get it unless people are educated about what's going on. One of my good friends here on YouTube has autism. And somebody had cut her down because they don't know nothing about autism. They called her a liar. That's not right. That's wrong. You don't know what these people go through, whether it's autism, epilepsy, bipolar, no matter what it is. I've had people do that with my eyes. They take a look at me, okay? Oh, you can see, because people misjudge, they prejudge. They hear a word or they see something. They have what would you want to call it? Not a premonition. They have an idea of what something is. Like me, when I say I'm legally blind, it's like they cut off that legally part and they just hear blind, and it's like, oh, you're a liar, you can see. Well, people with mental disorders go through the same thing, but worse than what we do. Because people look on the outside. So they see somebody that they think is perfect. They don't know nothing about their lives and they're prejudged. And I want to ask everybody that watches this, please, I implore you, do not prejudge. Accept people for what they are. See with your heart. Don't see with these. Pretend you're totally blind and learn to see from here. Because when you see from here, you'll learn to accept people for who they are and what they are inside, and the outside won't matter. You'll have more understanding towards people. You'll be a much better person when you see from the heart and not the eyes. Believe me, I learned at a very young age. So to everyone that's watching that knows somebody that's bipolar, or maybe they don't, please pay attention to the series from the first all the way up. Don't try to jump in the middle. Catch each series from the beginning. You don't have to watch the bipolar if you don't want to. If there's something you want to learn dealing with something else I covered, be my guest to watch it. But when you do, watch it from the very beginning, because otherwise you're going to miss the whole puzzle. It's like when you have a jigsaw puzzle. You can't see the full picture with just one piece or two pieces. You have to have them all put together to see what the picture is going to be. It's the same thing with learning about these mental illnesses. You have to take in the whole picture. So if you're learning about bipolar disorder, please, I implore you, for the person that has bipolar, for their sake, whether it's your loved one, a friend, or maybe you just want to know so you can be a better person and you can understand more. Don't come in and try to look at it from the middle. Take it from the first one up. Watch it all the way through so you can understand the whole disorder. You need to understand it as a whole, not a part. So until tomorrow when we do part 2, I want to leave you with these words. Remember, you, that's right, you out there, I'm looking at you. You're important to me. You are uniquely made. You are special. You are one of a kind. And I love you for who you are. I accept you for who you are. So until tomorrow, mwah, bye. Love you all.